Hello everyone, I'm Dr. Francisco. I'm alive and live in Facebook once more. This is the Kidney Health Education and Kidney Disease Awareness Facebook video group destined to help patients with kidney disease or with any sort of related kidney disorders to understand the disease better so they can come into greater terms with it, but also they are aware of what things can happen and act preemptively and preventively to minimize complications and worries, and also to take better decisions with their own doctor or with me if they choose me. This is video 56, is the second season of the series, the third video of the new season, the third video on urinary stones, and today we're going to discuss a very interesting topic, how urinary stones are treated. So let's start with it. As mentioned before in the previous videos, there are few types of stones with different associating causes, and some distinct treatment or preventive measures must be implemented. So our diagnostic strategy and treatment advice must be personalized. When the stones are of significant size or they are symptomatic, meaning the patient has got symptoms already, pain or blood or any sort of discomfort, or when they are complicated with an infection, obstruction, or different degrees of kidney failure, it is ideal that patients are co-managed with urologists, as they are the surgeons who eventually can remove the stone or relieve a urinary tract obstruction, if it is necessary, to prevent or minimize damage to the kidneys. In the management of stones, both the urologist and the nephrologist plays a role. We both take care of the kidney, but in different ways. They are surgeons, we are more physicians advising on medications, they are advising on procedures or surgeries. There are different methods of stone removal, depending on the stone location, urgency, accompanying complications, and other illnesses that the patient might have. If the urinary stones is obstructing and complicated with an infection or kidney failure, the urinary system can be decompressed using a nephrostomy, plus a urinary stent that is usually inserted as well, what actually means putting a tube by piercing the skin near the kidney at the back, going all the way to the main urinary tube, the main urinary tract, so to drain the stagnant urine because of the blockage by the stone. And in many occasions, another tube or catheter needs to be left behind, inserted in the urinary system for different periods of time to maintain the urinary tract open so the urine flows, while another type of therapy, more definitive therapy, is implemented, like another procedure to remove the stone or a surgery. As mentioned, this is part of the expertise of the urologist more than the nephrologist, and he can advise patients better on the suitability of this treatment that I just mentioned or the treatments that I'm going to mention next. If there is no emergency, typically urologists suggest either removal of the urinary stone by uteroscopy, that means putting a camera tube and removing the stone through the urinary tract, or by extracorporeal shock wave lithotripsy, ESWL, or laser lithotripsy. This term sounds very funny, but it just means destruction, fragmentation of the stone. Simplistically speaking, those methods, either with the shockwave lithotripsy, laser, or other techniques, work by shattering the stones into smaller pieces that can be easily removed by other procedures, or they can be passed in the urine. It seems to be that the ureteroscopy, the one that introduced the camera tube and you probably can destroy or drag the stone, is more effective, but it is invasive, while the other one, that's what's called extracorporeal, out of the body. However, some stones need to be removed through surgery, meaning opening of the skin, and go all the way to the urinary tract, either laparoscopically or, like a proper surgery, especially if they are too big or they are complicated, or if the previous procedures fail, if they have been attempted. If the urinary stone is complicated with a urine infection, a urine culture must be obtained and patients should be started on antibiotics. And the type of antibiotics must be modified once the bacteria is identified and adjusted as necessary. So, what I do as a nephrologist? As a nephrologist, I do not do any of these procedures or surgeries. As I told you, I am a physician. We are physicians. But typically and importantly, my focus, or the focus of the nephrologist, is on the medical management of stones, their associated metabolic problems and controlling them. So, important matters for the prevention of the formation of new stones in the future, giving advice also in lifestyle and diet to prevent those stones, and also give advice regarding the kidney function, because sometimes when the stones block or there are other complications, the kidney function can be affected, and we need to protect the kidney as well. This can be acute blockage of the urinary tract that can cause acute kidney failure, but also the stone through a long period of obstruction, sometimes because they are not identified, they can cause different degrees of chronic kidney failure, and in occasions total kidney failure. And then advice on dialysis therapies must be considered, and we as a nephrologist are the best person to advise on that. I will talk a little more about prevention in more detail in coming videos, so just stay tuned to this video series. I hope you found this video useful, and if so, please give me a thumbs up, comment. I can answer your question. If the question is very general, I'm very happy to answer in the group. If it's something more specific, you can contact me professionally, formally, for a consultation, and then I can give you, a personalized advice as well. But just please share the existence of this group for people that might benefit. We are already in the second edition, 56 videos. It has been a success. It's a non-profitable initiative, but I have received many comments that patients, their relatives have benefit from reading the ebook that was generated after these videos, and now I am updating it because of watching these videos. But not only patients or relatives, also nurses, dietitians, even some doctors. And I'm proud to say that the NKF of Singapore, the National Kidney Foundation of Singapore, is using some of my the content of my ebook and videos in some of their posts to promote also kidney health. So that is something that it really honors me, but also is some motivation to continue this, because indeed there is some effort behind it. But please don't hesitate to give me some likes, so I know that you find it useful. So because we are still going to produce many more topics, all with the aim of helping you. And in these times of COVID-19 that you might be afraid of seeing the doctor, you might be in lockdown, or some medical care has been postponed, especially the elective, to later, but you still require advice, you still need medical information, then these services, these initiatives can help you to at least understand a little bit more things and guide you how urgent things can be. Don't take this, there is no treatment advice on all this, it's just general, but then to be more equipped to discuss better with your doctors. But definitely, if you need my help in my clinic in Singapore, but also do telemedicine services, you can also contact me, and don't need to wait until the lockdown is over, because we never know. The situation is very volatile. But remember, stay safe, stay healthy, meaning take good care of your health, get rid of any bad habit, smoking, etc. Still, you can do a lot of exercise. Check me out in my other company, Olympia Lifestyle by Dr. Francisco, giving a lot of tips how you can remain active for health mainly, despite lockdowns at home with no excuses initiative. Because if you remain healthy, even you have diseases or not, it doesn't matter. Remaining healthy is better for your overall self, but also in these times of the COVID, the healthier you are means the less vulnerable you can be to catch the infection, or if you unfortunately catch it, so to have less complications. Yes, vaccination is super important. You have the opportunity, just get it as soon as possible, providing there is no potential side effects. Consult your doctor, obviously, always. But if you have the opportunity and no contraindication, get it as soon as possible. Continue with the same precautions, and stay healthy. No, eat healthy is the best time, and there is never too late to start eating healthier, to start being more active, to get rid of extra kilograms, to control the blood pressure better, to control the diabetes better. And I help my patient clients to do all that. You can do it solo, you can do it with someone else, you can do it with professionals like me. But the point is really put that as a priority in these difficult times with the COVID-19, that there are new strains and things are volatile. I'm not trying to scare you, just simply to put life into perspective, and you can do something, if not to prevent it totally, but to minimize the risk of you or your loved ones and your fellow community is protected against the virus. And one of the ways to fight this infection is by getting vaccinated, following all the recommendations to minimize the spread or that you catch the virus, and you, by remaining healthy, protect yourself, but also you can protect, the spread. If you catch the virus and you eliminate it, so there's chances that you probably, or you are immune to it, there's chances that you can transfer to other people, no? So it's all for our betterment and the benefit of our fellow human beings. Okay, I'm Dr. Francisco, wishing you the best possible health. I talk a little bit more and diverted to the COVID a little bit, but because it's important, these times are crucial. So do your best, stay safe, stay healthy, take care. Bye-bye.